Good morning. Call the meeting of the Community Health and Safety Committee of the Kent County Board of Commissioners meeting to order, Tuesday, June 24th, 8:32 a.m. Second item on the agenda is public comment. Anybody from the public wishing to address the committee this morning? All right, seeing no one, we'll move on to item number 3, which is approval of the minutes. Is there a motion to approve the minutes?
Motion to approve.
Moved by Commissioner Bujak, supported by Commissioner LeGrand. All those in favor say aye.
Aye.
All those opposed say nay. Minutes are approved. We'll move on to item number 4, which is special order of business. We have 2 presentations this morning. We'll start with Mr. Mike Gusweiler, President of the West Michigan Sports Commission. Mike, good morning. Thanks for being here. We look forward to your presentation. You can begin when you're ready.
Yeah, appreciate that. Thank you. I always appreciate giving our annual presentation to the commissioners, and it's great to see you all. It's a different format, but nonetheless, I appreciate being here and being able to give this quick update on our work. I like to start with our mission. We're an 18-year-old organization, 501c3 nonprofit. And our work is to be an economic generator in the county. We do that through sports, but it also enhances our quality of life. It brings new dollars into the community that otherwise wouldn't be here, and adds vibrancy through sport. Our staff has grown over those 18 years from 3 full-time staff members to over 10 full-time staff members. We have, in our various operations that I'll go over with you, over 50 temporary seasonal employees that we employ each summer, and we have a robust intern program. On this slide, I identify that we're award-winning. We have a Northwood University grad that received a 20 under 40 recognition. Last year, we received through our professional trade association the Sports Commission of the Year, and that's a 800-member organization. And this year, I was humbled to receive the Executive of the Year. Now, being an economic generator is our core mission. We certainly put our focus towards that, but we also realize we need to be a community player. We need to ensure through sport that, all are being included. And so we started this Victory Lap Community Fund to support organizations that were hitting on that specifically of bringing sport to the underserved populations. And we collect dollars through our fundraising capacities in our golf outing or annual luncheon. And we have a grant program that these organizations and others approach us to support, and we're pleased to do that. And speaking of our resources, and they have grown, fortunately, thank you to the county and the work that you all do, but also our partners in Experience Grand Rapids. You see in this pie chart that predominantly our funds come from a contract that we have with Experience Grand Rapids. It is dollars provided to us through that contract and hitting measurables that is through the hotel assessment and the lodging tax contract that they have with the county. And then rounding out the rest of the funding pie, we've got our other 2 operations that, again, I will touch on, but the Meyer Sports Complex that receives revenues through rental of the fields, concessions, and parking, and our Meyer State Games of Michigan that receives registration dollars through athletes that participate and also sponsor dollars. And then, as I mentioned, we have some special events that where we fundraise. And then the expenses go exactly to our mission. It's attracting people into our community on a statewide, regional, national, even international basis, doing that through our Meyer Sports Complex, through our state games, and then through our core operations of going out and bidding on these different events or working with locals that bring events to us. So doing that through our marketing, event services, sales, and of course then fundraising. Overall, it's a growing industry. It's over $50 billion in measurement, and again, it continues to grow. We were formed in 2007 in a recession, and we've often been identified as recession-proof. perhaps, don't want to, use that term heavily, but it has proven, and I'll show some of our key performance indicators of our continued growth that has happened. And, what we find in the industry of youth and adult amateur sports is that families still want to be out. They want to get their kids participating in sport and getting the benefit of sport, and they use it as a mini vacation. We've got many different key performance indicators, but these are our three primary ones. We want to produce new hotel room nights. Each year is a little bit different in terms of the number of events we have on event calendar, how large those events are, and the room nights they're producing, but the mean average is an upward trend from 2007 to current day, or at least numbers that we have collected through 2024. The only bogey in that, of course, was 2020, and we all know what was happening in that time frame. Number of events, as I mentioned, will vary over the course of the year, or over the course of year over year, but we're averaging over 100 events now. And all of that goes back to being that economic generator and looking at the local taxes that we help bring in. And to date, it's over $3.5 million that we brought back to the county through the lodging tax and the events that we've hosted. Some of those numbers are shown here in our core operations. Again, the West Michigan Sports Commission core operation of going out and attracting different events. So we're working with locals to help logistics and putting on those events. 112 in 2024. We use an economic calculator that is specific to sports, created by Destinations International, and is pretty reliable, used throughout the industry, of over $90 million of direct visitor spending that came into our county. Into all the different businesses that certainly many of you support or perhaps even own, and nearly 50,000 hotel room nights, bringing in over 250,000 participants and spectating family members. Myers State Games of Michigan, we started that in 2010. We're wrapping up. Actually, we've got a couple more weekends of the 16th rendition of those games for the summer. We also put on winter games. We started that about 5 years after the summer games. And so this is collective of winter and summer games. In 2024, 63 different sporting events. We work with our local partners in each of those sporting events that want to participate in this larger sports festival. It gives them certainly a bigger stage to stand on and attract more people into what they're doing, and it gives us the resources that we need to put those events on. It's a wonderful event that brings people from throughout our state. We're hitting nearly all of Michigan's 83 counties, over 8,000 athletes, and again, about $2.5 million in direct visitor spending. We just had our opening ceremonies. We do that on the main weekend. Commissioner Hennessy, thank you for attending. You're a regular there, and we appreciate your presence. But about 2,000 or more athletes and their families that join us at the Myers Sports Complex. We have former Michigan Olympians that come and join us. We typically have, through our sponsors, an individual speak to the audience members and the participants around an athlete oath and how to act when competing in sports. And then we do a lighting of the cauldron after a parade of the athletes. So wonderful event. You're always invited, and we'll always send out an invitation to all of you and hope to see you there. Myers Sports Complex, of course, I was in front of the County Commission not long ago talking about the impact of the sports complex. These are 2024 numbers, regularly over 20 tournaments. This year, I believe we're looking at 22, and these are weekend tournaments. The weekend tournaments bring in people from throughout the Midwest and even further. When we talk about USA Softball, we've had people as far as Texas and Florida, and the number of spectators through regularly seeing 650 to 700 teams and nearly 5,000 hotel room nights that the direct visitor spending is eclipsing $9 million annually. We just celebrated 10 years, and we're in our 11th season, and we saw the impact that this is having and the reason to expand. And so certainly that focuses on what we're doing out there to have an even greater impact. We started the Winning Streak campaign a couple of years ago. We wanted to bring parity and equity. We want to do some improvements. We have Aquinas College baseball team playing up there as their home field. We have the Miracle Field that offers opportunity for kids with disabilities and adults, quite honestly, that participate in leagues. I believe it's 135 players now coming from over 60-mile radius. They come there and participate in spring and fall leagues. Well, that special surface requires a 10-year maintenance of tearing it up and replacing that, and we wanted to ensure another 10 years of that field. And then adding the new quad, I call it, really 3 fields, but that parity and equity to that with the championship softball field. Thank you to Kent County and the commissioners in contributing to this project. We leveraged the dollars that we received from you, as well as from the state through Senator Huizenga and through the federal government through Congresswoman Skolten to attract $8 million in private, corporate, and philanthropic giving to help grow this greater than $14 million community asset. And you see from some of these photos, this is early on in some of the progress of beginning to do the excavating and some of the site clearing. Wonderful groundbreaking ceremony. This is our championship baseball field with the synthetic turf that we put on there. It offers for a greater season of playability. And certainly we've gotten great remarks from all the participants, both local and from out of town, of how much they enjoy that field. And then some of the championship softball field, certainly welcome to have any of you come out there. If you'd like to visit and like to receive a tour of the complex, if you've not been out there, I encourage you to do so. It's really quite the asset that we have in this community. So with that, I again appreciate this opportunity to give an update. Happy to answer any questions if you have any, but appreciate the continued support that we receive from all of you commissioners and from Kent County.
Thank you, Mr. Gusweiler. Appreciate that overview, and thank you for your leadership with the Sports Commission for many years and all the activities and events and economic development that you bring to this county. We appreciate all those efforts. So,
thank you.
Any commissioners have any questions? Commissioner Bujak.
Thank you, Chair. Mike, very good presentation. I've learned a lot in the last couple of years about the importance of the Sports Commission and really understand its purpose. And now, seeing all the economic benefits from, all the work that you do, I really appreciate, what you do regionally and, for the city of Grand Rapids and Kent County. Question about the soccer stadium. Are you going to be involved in that, and how will that impact the, formula that you've got going on, anticipated growth?
Yeah. Thank you. We have been pulled in those conversations. We were pulled in during the Destination Kent campaign to increase the lodging tax and explain that it's a visitor tax, that our locals were not taxed on that, so that could in part help fund the soccer stadium and the amphitheater. Having professional sports in our community for our purpose helps us market the destination and show, look, we are very sports forward, sports centric. It also offers opportunity to have facilities like LMCU Ballpark that the Whitecaps play at, like Van Andel Arena, where we're able to pull some different events in. We brought MHSA wrestling, some USA figure skating events, and we're always looking at more opportunities. So the Amway Stadium will offer that. So the part that we've been pulled into is on the non-soccer dates, how can we bring events that will have an impact on that one field? And I was part of the design build committee, at least participated on that to lend my voice of, obviously we want it to be a nice, pristine soccer pitch for this pro team. But will we have the capability to bring in football for MHSA or certainly lacrosse and some of these other rectangle field sports, even marching band competitions with an 8,500 seat facility. So our our team began working on just a running list in our office. So we've got about 24 events on that running list that some have reached out to us. We've had conversations with others. We just met with MHSA again and talked about some of their finals, and they're very interested, and as well as our different college conferences that are in the area. So that's the role that we'll play, and our preference would be 16 or 20 fields because we can bring in then 500 teams and have that greater impact. In this type of setting, it's great. It's going to be beautiful, but limited on the number of teams and impact we can have.
And one more question. Where are we at 6 months with hotel room in comparison to previous years? Are we on track, ahead, or?
It's always lagged, and we get our information through our partners at Experience Grand Rapids. They run a Smith Travel Research Report, or they're part of that. And so I don't have those specific numbers. I know, some of these past months in revenue in hotel rooms sold were higher, but occupancy was a little bit lower. You've got more rooms to sell, and so that, becomes a little bit of the challenge. But I think we're on par, we're on course, and expect, we'll continue to be so.
Well, thank you, and I appreciate getting invited to come out and look at the complex. I'd like to do that
Yeah,
someday.
please reach out to our office.
Thank you, Commissioner Bujak. Commissioner LeGrand.
Thank you, Chair. Commissioner Bujak sort of already asked most of my question, which was your relationship to the soccer stadium. So is that a formal relationship? Are we contracting? Is the stadium contracting with you to fill spaces, or are you just kind of helping them figure it out at this point?
No, much like the Convention and Visitors Bureau is to the convention center, there's a booking policy that the CAA creates to ensure that they have the runway and lead time to bring in events that bring in people into our hotels and our restaurants. So we don't have a formal one. I'm working with Rich McKeegan to create one that says on non-soccer dates, at least 12 months out, the Sports Commission is the entity that will bring events to us. Now, there will be thresholds that we have to hit of how many room nights it might generate based on one field again. And that will be that threshold of do we bring this group in now, or do we wait and try and bring in something that will have that impact on the lodging tax and on our local businesses. And that's what I'm looking for. Usually we know 12 months out, a year out, any event that we could put in there. Sometimes things pop up and we can put things in. And then within that 12-month period, it really becomes more open to local community events. And so that's what we're asking for. So that would be the only formal relationship. There wouldn't be in a contract for us to be an operator of any sort. We're just trying to fulfill our mission on venues that are available.
Great. And then I was just curious about the fundraising. You said was like 8.6% of your budget. Is that kind of a steady year-to-year thing? I know you just had a capital campaign, so I
Yeah.
didn't know if maybe you expended more.
No,
recently.
that percentage jumped up because of the Winning Streak campaign for sure. A lot of my time went into it. We hired a director of development, which is a new position for us. I can see that hovering 5 to 6% of our work to try and attract these local philanthropic dollars into our many of our different efforts, because we're going to continue with that position where we won't have the campaign going. So it's going to dip down, and I'll spend more my time with community relations and other factors.
Great, thank you.
Thank you.
Thank you. Anybody else? Commissioner Hennessy.
Thank you. I always find it slightly dismaying to hear everything put in economic terms, in terms of what we're doing. Having been at the opening ceremony, I saw a lot of people having fun, a lot of joy, and a lot of family time. And I, look at your mission statement, and it is very has an economic focus. And I do think you are about more than that, and rightly so. And so my question, though, is, it is somewhat economic driven. In 2007, there were hopes that you would, that this organization would bring hotel room use to the outlying hotels. Has that happened?
Yes.
Is that continuing to happen?
That is predominantly where our people stay. Yep. Building the sports complex and even in youth and adult amateur sport, there's not many that are going to stay at a higher rated downtown hotel. There are some, they want that amenity. They have Marriott, Loyal Points and some of that. But most of our work, I say youth and adult oriented, so we do have a lot of adult events. But most of it is youth. And those families, they want to stay together as a block. The parents and the kids, they want a pool, they want free parking. Typically, they want free breakfast. You're not going to get that at a downtown hotel. So all of that is in the suburban outlying hotels.
And just to add, at the opening ceremonies beforehand at the hot dog dinner, I met an Olympian who kayaking, and he was an older gentleman, and it was just fun to see older Olympians come back and to join in the fun of the event. It was fun, and it is fun. That's why I continue to go.
Yeah, we had Olympians from probably 5 or 6 different generations, of the Olympics. And Bill Smoke, that you speak of, he has about 82 and has come 5 or 6 years to the opening ceremonies. We do an Olympic Day, with YMCA and bring these kids out for a field day and meet these Olympians, see their medals. So it's a fun event. We, thank you for your comment on, we're more than just economic impact. I think, when we try and you look at our measurables, that's what we point to. But, an event that we're going to hold this summer, mid-July, is with Mary Free Bed. It's partnership with Move United is the organization, and it's the Hartford Nationals for its largest youth and adult disabled multi-sport competition in the country. And so we're proud to host that. We'll host it this year and next year. We need volunteers. So again, if you want to see firsthand what it's like to, participate and see the participants of this event specifically, reach out to us. We'd love to have you, even just for a day, because it does bring smiles. It's family oriented. These are people that have never been to Grand Rapids and Kent County before. We're proud to host them.
Thank you.
Great. Well, thank you very much, Mike. Appreciate your presentation and keep up the great work. We appreciate your leadership.
Thank you.
Okay, we'll move on to our second special order of business. We have part 2 from the Health Department. So appreciate Dr. Adam London here, Administrative Health Officer. I call it Director of the Department, but
that'll work.
This is Administrative Health Officer. This is the official term, I think. So
Yes.
welcome, Dr. London. Thanks for being here. Appreciate your presentation.
Thank you and good morning. It's always a difficult challenge following the Sports Commission. But we'll do our best, and I do appreciate Mike and his team and all that they're doing over there. They've been great friends of public health over the course of their time here in West Michigan in keeping our community healthy and active. That's an important thing that they do. So this is part 2 of our report. I am joined by Joanne Hoganson this morning. Last month, I profiled the Environmental Health and Community Clinics divisions. This time, I'm going to talk a little bit about community wellness, and that's the area that Joanne is the division director over, along with our Center for Community Health Strategy and some of the work that we're doing in communicable disease and epidemiology in the community. Last month I talked a bit about our mission statements, so I'll breeze through those, the vision that we have, and bring it right to Community Wellness Division, which has a huge number of programs that are working out in the community. And these are largely nurses and social workers, health educators that are doing work in the field, as opposed to the work that I described last month in the clinic, where I have some of those same professions inside our locations here in Kent County. These are people who are working in the homes, in the schools, providing programs, such as those that are listed here. one of which is the maternal infant health program. During 2024, that program served 1,500 families with nurses, social workers, and dietitians, providing almost 9,000 home visits for families. And one of the important goals of this program is to help moms and expected moms bring those babies to a full-term, a birth that's not low birth weight, a healthy birth, and to see those young families, especially the highest risk families that we serve, are off to a great start, as great as possible. And we also weave in programs such as Strong Beginnings and the Nurse Family Partnership into that to make sure we're maximizing the amount of work that we can do for young families and babies in the community. Hearing and vision screenings. Last year, we provided over 36,000 hearing screenings for our school students here in Kent County. About 4% of them, we actually identified a hearing deficit, where we referred that family on to a provider who can help them to identify what's the root cause of that and make sure that's corrected. We also did 50,000 screenings of students for vision, and about 13% of those came back as identifying a deficiency in vision. Now, some people say, well, those aren't life and death things, hearing and vision. And so why are we focusing our time and attention there? Well, in some cases they may be. And certainly when we look at academic outcomes, social outcomes, life outcomes, if we can identify hearing and vision deficits early on and get correction, those students will do better in school, they'll do better in life, and they'll make better decisions later on in life as well because they're on a healthier pathway. Childhood lead poisoning, talked a little bit about lead from the environmental perspective last week. Once we identify a child and a family that has a lead exposure issue and a child with an elevated level of lead in their blood, Joanne and her team will work with them to make sure they're getting the aftercare necessary and the referrals necessary to make sure that that level of blood is coming down and that they're getting referrals to any supportive services they may need to deal with that issue. And Children's Special Health Care Services, which is one of the programs I think we're the most proud of at the Health Department. This is a program that is designed to serve those families, in many cases, unexpectedly are dealing with a chronic and severe health issue to a child. It may be a congenital anomaly. It may be an injury at birth. It may be an injury, in the childhood. It may be autism. So many things that a family wasn't expecting, and now they're challenged with this thing that they have to overcome. This is a program that comes alongside those families, coaches them through some really important questions they may have, builds a social support of other families to help provide that network for them, and make sure that they are supported so that they also have a future that's positive and they have the help they need for the best outcomes they can get for their child. We have a number of other programs here, and I won't go through them all, but I will give Joanne the opportunity if there's anything you'd like to add about those programs or about any of the others.
Yes, good morning, Commissioners. I would like to take a minute and talk to you about our kindergarten oral health assessment. In 2022, the state of Michigan added to the list of prerequisites to enter kindergarten that an oral health assessment must be done. And we have contracted with the Michigan Department, with My Community Dental Clinics, MCDC, which is an agency that has clinics right here, dental clinics right here in West Michigan. And we have begun in this academic year providing screens of the oral health of children that are about to enter kindergarten. So it's a pretty simple and quick process of a simple visual inspection of a child's mouth before they enter kindergarten. And one of the key reasons that we're participating in that, besides that it's the law, is that the number one cause for absenteeism in small children in school is dental pain. Who would have thought? I would not have necessarily thought that, but children are missing school because they have toothaches. And very many of our most vulnerable children are not getting early dental care. They're going to kindergarten with a mouthful of caries. And so our oral health screen allows us to identify those children even before their first day of kindergarten, so that they can be referred for dental repair of their teeth before they start school. So it's a great program. We were one of the last counties to get on board, and that's because we're so big. Some of the little communities have 300 or 500 children that have to be screened. We have nearly 8,000. So that's how many children start kindergarten in Kent County. It's between 7.5 to 8,000 kids start kindergarten each year, and they have to have their oral screening done. Up to this point, we have done almost 2,000 children. So we are pleased with our partnership with an agency that's helping us to get these screens done, and we're hoping to see a difference in absenteeism amongst our little residents in Kent County as a result of having better dental care.
I think health education and life skills is another area that we were really proud of. This is a program that is providing education and empowerment to middle school and high school students on better choices in life and how to avoid substances, and particularly smoking, alcohol, drugs. You want to mention anything about that and the scope of that program?
Sure. We have 4 full-time health educators who go into primarily middle schools, because when we were going into high schools, what we found is it wasn't really pure prevention. These are kids that have already experimented with substances. So we're focusing a little bit younger at middle schools and helping them understand the risks involved with substances. And it's a focus on tobacco, marijuana, other hard drugs such as the opioid, helping to prevent the opioid epidemic that's happening in our community, and giving them not just knowledge, but also the skills they need to resist peer pressure, to have confidence to say no, to recognize what are some alternatives when they're feeling discouraged or depressed or anxious. Many kids, the only thing they know to do is to resort to substances, and we're presenting with them with some other healthier options. So it's a great program. It's evidence-based. We know that it works. It makes a difference in the lives of students, and we have really good reception from the students. We do a pre-test and a post-test, and what we're finding is they have better knowledge, and they state that they have better resources to help them make wise choices.
Thanks, Trey. So as you can see, Joanne and her team have a lot of passion for this work and for really trying to do what we can to make life better for families in the community. Our Center for Community Strategy is a very small division, only about a dozen employees in this area, that is working to maximize this unique quality that we have here in West Michigan, this desire to collaborate and to really be a force multiplier in that area. One of the things we identified about a decade ago was that with the Affordable Care Act, there's a requirement that nonprofit healthcare systems need to do a community health needs assessment once every 3 years. Here in Kent County, we have 5 nonprofit healthcare systems. We have Corewell, Trinity, U of M Health West, Mary Free Bed, and Pine Rest, all of which are required legally to do a needs assessment. It's a pretty expensive process. It also requires a lot of data collection, surveying, and all of that, which would be exhaustive for the community to respond to this many surveys. It would also be very expensive for each of them to do one of these assessments. We recognize the opportunity, and we actually, as the health department, facilitate a single community health needs assessment, where they all contribute financially to that. They all chip in about $20,000. We match that, and together we have one community health needs assessment that we think is really efficient and effective for the county. You can find that on our website. It's about 300 pages of really fascinating data about the health of the community, and that's an opportunity and a great success in 2024. We're starting that process now for the next iteration of that survey, and we expect that to, again, include all those partners. Once that assessment is done, every cycle, there is a prioritization process that goes in place where we identify what are the community's priorities and how do we have realistic strategic plans in place to punch at those priorities. Those are our community health improvement plans. Over the course of 2024, we actually received about $250,000 in grants that we were then able to push out to local nonprofit organizations with small mini grants in order to address some of those objectives that were identified in that larger community health improvement plan. Great example of us trying to collaborate and empower partners to do this important work. Opioid Task Force has been in place for about 10 years now. During the peak of the opioid crisis here in Kent County, we were seeing about 120 to 130 overdose deaths because of opioids, another 20 or 30 from other substances. We've made great improvements in this area. In 2024, we had 80 total overdose deaths and 45 related to opioids. So we've cut that number down over, in half with the number of overdoses that we're seeing here in Kent County. That task force is led by the health department, but includes a lot of participants from the education system, criminal justice, pharmacies, pediatricians, doctors' offices, the whole gamut of partners in this space. And it's really a model for how we can work together to do things like train on how to use naloxone and get distribution boxes out there and advocate for better policy and processes for physicians relative to opioids. That task force also was really instrumental to the county in our distribution and our plan for how to spend the settlement funds. And so they've had a huge voice in that. Healthy Kent produced a cannabis and pregnancy toolkit when marijuana was legalized for recreational use. That was very concerning to all of us in public health. And we realized there was going to be a lot of challenges that are faced by a number of systems and persons in our community relative to the much easier access to cannabis. And so this is a toolkit to help inform and to empower and protect pregnant women and children from easier access to these materials. And you'll see throughout the community our messaging and our education and trying to provide people with resources like safe boxes and all of the stuff that's necessary to try to build some literacy about how do we protect the community from this new issue. Then we had 8 interns during 2024, which is good, but we actually were about 20 to 30 interns prior to COVID. We'd like to get back to that number in the coming year. I want to talk a little bit about infant mortality in my last couple of slides here. We have an infant mortality review team here in Kent County, and that's been in place because we realize that when a baby dies, there are really important lessons to learn from that. In many cases, there are public health interventions that we can put in place to make sure that we're reducing the probability of that happening going forward. Well, 25 years ago, this community recognized that we had a very high infant mortality rate. Infant mortality rate is the number of newborns per 1,000 that don't survive to the age of 1. What you're seeing here in this table is the data for going back to 2012. The line on top is black babies in Kent County. You can see that has kind of fluctuated between 10 and 15 per 1,000. That's actually overall down quite a bit from where we were at 25 years ago, when it was closer to 20 to 25. So despite the fact it looks like it's trending upward, it's actually because of the small numbers that are involved there, the 1 or 2 additional deaths a year can really throw that off, but overall, it's trending downward. The next line down is the state of Michigan overall infant mortality rate, which is about 7. The next line beneath that is the Kent County overall infant mortality rate, which is about 6. Then the lowest line is the Kent County white babies infant mortality, which is about 3.5 to 4. Our goal here is really to see all of these lines converge at or near 0 as quickly as we can. And this is the purpose of many of the programs in Joanne's division in particular. So that was the rate. People often then ask, so what are the actual numbers of deaths? And figure 2 on the top here demonstrates that. You'll see over the course of the 5 years between 18 and 22, we range between 39 to 54. Again, this doesn't look like great progress in that small snapshot, but going back 25 years, we're down pretty significantly in infant deaths in Kent County. And again, we're trying to get that as low as possible. What's important with this infant mortality review team is that we're we're really dissecting each of these deaths to understand what were the upstream precursors and risk that may have played into these deaths. And so the bars that you see on the bottom demonstrate proportionally what was the cause of death for those children in each of those years. And you'll see that the darker blue color is perinatal, and those are largely children that were born premature, very low birth weight, perhaps had an injury during birth, those sorts of things. What we learned from that, and we ask a lot of why questions of the medical examiner and the physicians and others to try to understand, well, why and what can we do from a public health perspective to punch at that problem. And here's where we learn about things like the importance of tobacco cessation and not smoking during pregnancy, and nutrition, and trying to make sure they're getting early connections to an OBGYN. And all of these things, they're important to bring a child to a full-term, healthy birth weight and reduce as many risk factors as possible. That next lighter green-blue section is the congenital anomalies, also commonly known as birth defects. There's less that we can do in this space, but that's something we want to be very mindful of the literature and the developing body of science in that, to understand, are there things there that we can do to identify and perhaps prevent some of those deaths. Infections, of course, we're always worried about infectious disease and other gastrointestinal infections, foodborne illness, all of the other things that can threaten the vulnerable young immune system of a child. Sleep-related is that kind of darker green band, and that's one that is very important to us as well. And we've all heard a lot about safe sleep, and that's very intentional because it is heartbreaking and devastating when a child dies from a sleep-related cause. And I know the medical examiner's office and others will tell you that there's nothing more devastating than reviewing those cases and communicating with those families when, through no fault of their own in most cases, a child has died from a sleep-related cause. And there are opportunities there for us to make sure that people have the best information about safe sleep environments and trying to prevent those. And the last bands are other and undetermined, and those are largely accidents and things of that sort. And a lot of progress has been made in that domain as well, especially with car safety seats and other things. Great partnerships with law enforcement and others to get those car seats available to families throughout Kent County. Last slide that I've got is this one on notifiable diseases. And this is a requirement that physicians, when they diagnose a notifiable disease, there's a lengthy list of diseases that are required for them to notify us. They have to let us know within 24 hours. It's usually much quicker than that, what disease and who the case is. So we can then follow up and try to determine, are there others at risk? Is there something we can be doing? Are there people that need to have information about an exposure perhaps? Lengthy list there. I'm not going to go into all of that, thankfully, but I can't share that with anyone. If you have interest in looking at our notifiable disease report, this is a monthly report. The one you're looking at is December of 2024, so it's the year end for 2024. If you look closely, you'll see how many cases were identified during that month of each of those illnesses, how many were identified year to date. So that's a total for 2024. And that last column on the right is the median number of those illnesses reported over the course of the prior 5 years. Several that are noteworthy. HIV, you'll see an increase in cases. And again, we ask a lot of why questions. So in asking those questions, we don't think there's an actual increase in the prevalence of HIV in the community. What we think happening there is that we're getting much better and broader testing for HIV. Lots happening in the community. We're reducing stigma to testing, so making it available through our mobile units, main doctor's offices. We're at festivals and parades all the time with our unit. The great thing about that is that when we identify a case of HIV early on, there are great tools for treatment and therapy now to keep that viral load low and to prevent those cases from turning into full-blown AIDS cases. I think last time mentioned during the 90s, we were seeing 30 to 40 AIDS deaths a year here in Kent County. Now we see 3 or 4. And it's largely because of early detection and those therapies. Giardiasis, salmonellosis, shigellosis, these are all gastrointestinal illnesses, and if you look in this report, you'll see that they seem to be much higher. Again, that's because of more testing. In the past, these are largely gastrointestinal, so mostly diarrheal illnesses. Mostly in the past, when a person went to the doctor with those symptoms, the doctor would say, well, you got stomach bug, drink fluids, get rest, you'll be better. And normally that's the case. But there are things that we can do if we know specifically what that causative agent is to perhaps to reduce risk of those sorts of illnesses spreading in the community. So if we have a stool sample and a physician who's willing to test for that, we can identify, well, there's something waterborne happening in the community. There's something foodborne. Maybe it happened at an event. There are things, because of the unique reservoirs that each of these illnesses have, that we can do to try to reduce the overall occurrence of illness if we know. Hepatitis C, we're seeing great improvement there because of treatments that are available. We've come a long way with hepatitis C. Lyme disease is up, and this is one where we really think it is up. The identification of ticks in Kent County and really throughout most of Michigan, much higher, much denser tick populations. I remember as a child never seeing a tick. And now we're all seeing them on a very, very regular basis now. So it's something to be aware of. It's something that we can try to reduce through prevention. We can reduce the occurrence of Lyme disease, and if people are testing for it and they're aware of it, antibiotics can treat that. So that's something that, if we know about it, we can reduce the severity of that issue in the community. And then pertussis. It is a vaccine-preventable illness. We did see a pretty significant increase in the number of pertussis cases last year. And that's going to be part of the reality of the world that we live in, unfortunately, with a lot of vaccine-preventable illnesses. Vaccine rates overall are trending downward. And so I think everyone knows that, society is kind of grappling with this issue of how do we, as a society, address vaccine-preventable illnesses. What's our perspective on vaccines relative to the severity of illness? That's nothing we're going to solve here at the Kent County level, but something that we are aware of and we're keeping an eye on. So again, I've blown past my 10 minutes, and I apologize. I'll stop.
No, thank you for
Any
that
questions?
presentation. Appreciate all the information and work of our health department. Do commissioners have any questions? Commissioner LeGrand?
Thank you, Chair. Thank you, Adam. I am wondering, the Children's Special Health Care, that's a state program, isn't it?
It is.
So that is a program that you fulfill for the state, or does the state fund it, or how exactly?
They do fund it.
They do fund it,
And we
okay.
also, we can bill Medicaid for some of those services as well. But it is a statewide program. It's a program. And I will say, though, I think that we've plussed the program, especially with some of the work that we're doing, like with the, the weekly gatherings, things like that. But I'll let you speak to some of those pluses.
Sure. Children's Special Health Care Services, you might remember from many years ago, it used to be called Crippled Children's Fund. And it has been renamed and broadened so that we have 5 full-time nurses and a full-time social worker and a clerical support person. And they provide coordination of services. The other thing that has changed recently from the state and has allowed us to broaden our reach is that they have added new diagnoses to the list of children we can serve. So right here in Kent County, we have over 4,400 individuals enrolled in our program, and they have a nurse assigned to them. And so if they're at the pharmacy and they have a child with diabetes and they can't get their hands on insulin, they call our nurses, and our nurses step up and help find the services that they need and connect them with those resources. And the other thing is, most children with very complex healthcare needs have multiple specialists, and specialists are famous for not talking to each other. So the neurologist doesn't talk to the psychiatrist, who doesn't talk to the dermatologist, and our nurses make sure that they coordinate all that care to make sure that these children who are extremely vulnerable in our community, many of these are children who are on ventilators, children who have private duty nursing and are stayed at home, children in wheelchairs. These are kids that really need somebody that oversees all of their care, and that's what our team does.
Thank you. I'm really gratified having had a child with very complex medical needs, and it is overwhelming.
Yes.
And that you are providing that kind of service is really, it's really amazing.
Real quickly, one other
Yeah.
thing that they do, Adam spoke to it real quickly, is they connect these parents with each other. And there's a tremendous sense of support to feel like I'm not alone. There's other people in our community that have children with similar problems. They learn from each other, they support each other. And once a year, we have a big back-to-school bash, and all these beautiful little children with complex health needs, they all show up and they get face painting and get to, the sheriff's office sends their horses, and they get to see the horses, and the zoo sends animals, and it's a great event.
Oh, it's wonderful. I also noticed on the list of diseases that have to be reported, I didn't see measles on there, or does it have a name I don't recognize?
It is, and that's a partial list. The full list
I see.
is
Okay.
much broader than that, but those are the ones that we commonly have reported. There's a lot that would be a 0, 0, 0, 0. Measles on there, of course, we had one case this year, and we've had a number of cases statewide, so.
Okay. Yeah, I know it's been in the news now, so I didn't see it there, but
Yeah.
that explains it. And then last, I just wanted to give your department a shout out for the community health needs assessment, because it really is such a tremendous community resource to have access to that data, and it's so complete. And Janine, right, works on that?
At Maris.
And Maris, yes, and they just do such a fantastic job.
Yeah.
I've had a great time talking with them and learning about all that they do, and it's just such a service to our community
It's a
here.
great partnership, and also empowers a lot of nonprofits to make really compelling need statements when they're doing grant applications, because they have all this rich data available to
Yeah,
them.
I mean, we're so proud of our medical care in this county, but this kind of backbone to understanding the needs of the community is just such a big part of it, and I don't think you get enough credit for that, so thank you for
Pass that
that.
along to them.
Yeah,
Thank you.
please do.
I will.
Thank you.
Thank you, Commissioner LeGrand. Anybody else? Okay, thank you so much for being here this morning. Again, appreciate your presentation and your leadership over at the Health Department. Okay, we'll move on to item number 5, which is our agenda items. We have one item under 5A. It's the 17th Circuit Court Community Corrections Comprehensive Plan and Grant Application. I'll ask Jenny to give a brief summary, please.
This item requests that the committee recommend to the board to approve the annual Community Corrections Comprehensive Plan and application for funding under PA 511 of 1988. PA 511 provides funding for the Community Corrections Advisory Boards to administer and operate programs to provide alternatives to incarceration for offenders. And the state requires a resolution approving the plan submission from the Board of Commissioners.
Any questions or comments? I know our sheriff's here, always appreciate her attendance, and Commissioner Hennessy.
Thank you. I would just like to hear a little bit more about the program, and I don't recall seeing a dollar amount listed for it as well. And it looked like there's a number of partners for this program.
Good morning. If you could just please identify yourself for the record.
Sure. My name's Heather Blodgett. I'm representing the Office of Community Corrections here locally for Kent County. We work under the 17th Circuit Court. So as you summarized, the Community Corrections Advisory Board governs these community corrections dollars, which go to pretrial defendants and also offenders to essentially reduce prison commitment rates. And hopefully reduce recidivism in our community. We have 14 programs. They focus on our highest criminogenic needs, family criminality, criminal personality, substance abuse, mental health. So we work with a number of agencies to provide those services to offenders. If you give me just a moment, I will find that exact dollar amount for you, which is $1,142,000. $398. So we've made that request to the state. We'll know later this summer whether or not those dollars have been awarded in full or in part. Do you have any other questions?
Do you anticipate that there'll be any major changes in the allocations to specific partners?
No, we have shown in the materials provided, and I apologize because there are a number of programs and a lot of detail in there. There have been some fluctuations. Our program providers have maintained over the last few years, so we're not seeing large changes in who's providing the services, but those dollar amounts vary from year to year based on the number of enrollments that we receive. So as there is a larger need for the program, we fluctuate to meet those needs. And those largely, that's largely dependent on whether or not the judges are ordering those services and the Department of Corrections Probation Office is referring then to each specific program.
Commissioner LeGrand.
Thank you, Chair. I'm just wondering, given how much our county is growing, are we able to ask for more from the state? Or is the state saying yes?
So this is my second year with the Office of Community Corrections, so I'm trying to figure some of that out. My understanding for this year is that the Department of Corrections, Office of Community Corrections is not requesting a large number of additional dollars from the state, though they do continue to bring on more community corrections boards throughout the state. So it's not required that every county has one. We have had one for decades, which is wonderful. So I think they're trying to incorporate other smaller counties, but it does not seem that they are increasing the funding. And I think a large portion of that is balancing who's spending what funds where. So if overall the Office of Community Corrections at the state level is not spending out all their dollars, even though our programs might be, they're not going to ask for a significant increase. So we've asked for a small increase this year, and I'll be interested to see if they allocate that to us.
Thank you.
Anybody else? Okay. Thank you so much for that overview. Appreciate that. Do we have a motion to adopt agenda item 5A? Moved by Commissioner LeGrand, supported by Commissioner Hennessy. All those in favor say aye. Aye. Any opposed? Okay, motion approved. We'll move on to item 6, which is miscellaneous. Any commissioners have any miscellaneous this morning? Quiet bunch today. Been sweating for 3 days, so maybe you're still recovering from all of that. Well, good. All right. Seeing no other items on the agenda, do we have a motion to adjourn? Moved by Commissioner Merchant, supported by Commissioner Morse. All those in favor say aye. Aye. Any opposed? We are adjourned. Have a great day.